physical therapist on the internet.
Oh, hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
Today, this is an introduction video. Everything you want to know to treat knee pain successfully. It's an introduction to our program, which we'll talk about in a little bit.
Right.
Let's get right into this, Brad. So this program is designed to help you with knee pain. And what types of knee pain could we possibly help,
Bob,
Brad?
we're going to have videos that are going to cover knee arthritis, tendonitis, iliotibial band, IT band syndrome, knee bursitis, a lot of itises.
Yeah.
Patellar femoral syndrome, knee chondromalacia, if you're not sure what it is, we'll have that.
Yeah, watch the program.
Strains with muscles and tendons surrounding the knee, everything that relates that way.
Osgood-Schlatter disease.
Oh, we're going to have that one in there.
We will have it in there, some exceptions, but we will have a video on it.
Okay, good.
Knee pain is extremely common, as many of you unfortunately know, and many people are very surprised at how intense it could be. A lot of times they think, my gosh, there must be something really wrong with my knee.
Right.
But no, actually, a knee pain can be quite severe just from run-of-the-mill stuff. So
Not that you have to run to have it.
right. So it could be caused by weakness. It could be caused by tightness, or it could be caused by laxity in the knee. So that's some of the things we're going to look at. We're also going to look at your hip and your ankle,
Right.
Because they have a great effect on your knee.
Exactly.
Now, obviously, exception to this would be an injury to your knee. So, like if you're in an athletic injury, like ACL tear.
Right, if you have some trauma.
Right. So these are our goals with this program, and we'll talk about the program right after this, Brad.
Okay.
Our first goal is to get your knee joint working correctly. So we wanted to see if we get it moving pain-free through its range, and we're going to try to do that with strengthening and exercises.
Right.
So,
if you can get the joint moving freely, can dramatically decrease pain and increase your function and get you back to normal. So one step at a time.
well said, Brad. Next thing is we want to make sure we eliminate the knee pain makers in your life.
Yeah.
So if there's someone that's taking a hammer to your knee, we're going to stop them.
We're going to take the hammer away.
Right.
And that's a philosophical way to put it, but we're going to look at things that you may not be aware of that are irritating your knee. And when it's brought to light, you say, "Oh, I didn't know
Sometimes,
that."
just standing on your knee, on your legs with your legs locked back can cause knee pain.
And
just
you were
to give a little
right,
example.
and people sometimes are never aware of that because
No.
it's been a habit all their life.
Right. And our third goal is to strengthen the knee, because the stronger the knee will be, the more likely it'll be able to handle any future problems.
Exactly, right.
So there's a disclaimer in this video, which we'll talk about. Which you can read. I'm not going to read it right now.
A disclaimer?
A disclaimer, yeah.
What does it say? Something about us?
Yeah, well, you know how disclaimers are.
I know.
So, well, maybe right now we should tell you, Brad. So, yeah, this video is a part of a series of videos on knee pain. So you go to bobandbrad.com, go to the program section, and under that section, you'll find the one on knee pain.
Right.
We got, any idea, Mike, how many videos? 40 videos, maybe
Right.
30 videos?
Yeah. So you click on that, and the really big advantage of this, you don't have to go searching all over the internet. You're going to find all of these videos pertaining to the knee, and almost certainly you're going to find 2 or 3 videos that pertain to your question.
Your specific
Yeah,
problem.
They're about 10 minutes long. They have a PDF printout that prints out a review of the whole video and the exercises, so you can have it at hand. You don't have to go back and repeat the video or look at it. And
Well, how much does it cost, Brad?
Well, Bob, I didn't know if you were going to ask that, but it's unbelievable. It's completely free.
Yes, it's our gift to you.
We don't even ask for an email.
Yeah.
I mean, this is a program. I don't think there's anybody else that has anything like this.
That's right.
And Bob's responsible for this. He's thought of this idea, and
Well, I think you had a big role in it, Brad.
well, it was just my face.
All right,
here.
let's talk about, kind of our philosophy with knee pain. One, we think it's up to you to get better. We're not going to be able to do something for you. You oversee your body and the outcome. You're in charge. Somebody's not going to swoop in and magically heal your problem.
Right.
There's not a magic pill, surgery, or shot that'll solve the problem. you've got to take charge.
Right. Oh, there could be a knee replacement involved, but we're not.
Right
We're
away,
avoiding that.
right away, you ruined my speech.
Oh, I'm sorry, Bob. I bumped in.
So the body has a great capacity to heal if you allow it,
Right.
and create the environment. So we want to do that.
Sure.
You must believe and follow our recommendations.
Sure.
I mean, Brad and I'm sure you had this experience. I can almost tell right away whether a patient's going to get better because some of them just totally buy into what I'm saying,
Yep.
and they're the ones that get better.
Yeah, they
do.
go home and they follow our
Yes.
instructions, do what they should do, avoid
Right.
what they shouldn't be doing, versus some people.
That they think they know already, and I'm like, why did you even come to me if you know how to treat this? I mean, so
Yeah.
So again, we're not big believers in having therapists or doctor do something to you. We want you to do something to yourself, where
Right.
you, supply the exercises, stretches, whatever you're doing.
Take control of your health.
That's it, Brad.
Oh,
Check
really?
out the program. I'm sure you will be pleased with it.
Yeah, it's a wonderful deal. Can you say that deal?
Yeah.
Yeah.
Thanks.